Terry, I know that some chemotherapy drugs, not all, can produce mouth sensitivity or even actually mouth ulcers. Could you tell us more about that?
Sure. Mouth sores can happen with different chemotherapies. Not all chemotherapies will cause mouth sores. What we like folks to do is just to use a soft toothbrush and to avoid rinses that have alcohol in them or peroxide. There's a very good preparation that folks can use that's recommended by a dental team, and it's just salt and baking soda, warm rinse a couple times a day. So that's a very clean rinse for folks to use.
So you mentioned the baking soda and salt rinse. How would somebody prepare that rinse?
It's just a teaspoon of salt and a teaspoon of baking soda and mix it up in water, and you can do that several times a day, and that's a nice healthy rinse for your mouth. And a lot of folks make a preparation in the morning to kind of get them through the day so that they can just routinely do that several times a day.
And that's about in a quart of water or?
In about a quart of water,
okay.
Yeah.
Are there any other medications that we can use for patients who develop painful mouth sores that are more problematic than the rinse is taking care of?
There are a few other preparations, and if you do have mouth sores, we want you to call in and check in with your team and let us know. There are a couple things that can sort of relieve some of the discomfort that are numbing preparations that can be called into the pharmacy. And sometimes the mouth sores can prohibit folks from eating and drinking, so we want to know if you're having, those sort of problems to call in and check in with us.
And probably avoiding very acidic foods is helpful, although that may be common sense when the pain starts coming in, but
Yeah.
you have to, as you said, listen to your body and know if you're having pain from certain foods like tomatoes, you'll want to specifically avoid those.
That's true. Juices and red sauces, things that would have acids in them, the fruits and vegetables definitely will increase the discomfort or pain that you're having. And just depending on the chemotherapy regimen, some folks don't have any mouth sores at all. Some folks have a few. So we definitely want to know about those. And a lot of times, or sometimes, folks may need a little something to relieve the pain from that.
Sometimes people come in with things they consider to be mouth pain or mouth sores, and they actually have evidence for what we call thrush. Can you tell us a little bit about that?
Most people have heard thrush, and babies get it quite often. It's the white stuff that's on your tongue, and a lot of times folks can look in the mirror and look and see that they have it. It's very uncomfortable. It causes a bad taste, and it won't go away with just your general mouth care. So that's one of the things that if you see in your mouth or you think that you have, we want you to call and let us just take a look and see if that's the case. There are medications that will clear it up pretty quickly.
And as you said, babies get it, but also patients, for example, with a compromised immune system or who are taking significant amounts of steroids or prednisone may be especially susceptible to that.
Right.